Last week, we talked about dental data annotation and the webinar that was conducted by Dr. Amandeep, where she teaches dentists how to create bounding box and identify and label dental features for AI dental data annotation. This was the just first of emerging career options for dentists outside traditional clinical practice. In this series, I'm going to introduce you to more dental job opportunities that you may not have heard about. Hi, I'm Dr. Alina, a dentist by profession. Alongside my clinical background, I work remotely in dental data annotation and medical translation. Using my dental expertise, digital skills, and language knowledge to contribute to healthcare projects from home. Next is aligner designer. So, as you know, a liner is a clear removable plastic tray that fits over the teeth and gradually moves them into a plant position. So, what does a liner designer or treatment planner do? This is the digital side of orthodontics. You have intraoral scan or digital impression of their teeth, and you have to create a virtual treatment plan. You review the patient digital teeth model, check tooth position, alignment, problems such as crowding or spaces, plan how individual teeth should move, decide the sequence of tooth movement, review the proposed aligner stages, make adjustment, check whether the final result matches the treatment objective. So instead of physically treating the patient, you are working on a computer based version of the patient's teeth. Many companies provide training on their own software and workflow. Your dental knowledge is often more important because you need to understand tooth anatomy, occlusal, tooth movement, orthodontic principles, treatment limitations, what movement are clinically realistic. The software is the tool. Your dental knowledge helps you understand whether the proposed treatment makes clinical sense. What is CBCT specialist or reviewer? You review 3D CBCT scans, examine tooth, roots, bone, sinuses, or other anatomical structures. Identify and flag important and anatomical landmarks. Review scan for finding relevant to dental or implant cases. This is used for sinus evaluation, wisdom tooth assessment, complex dental cases. What does the actual workflow look like? First is CBCT. Is scan received? Then scan is reviewed by the dentist. Anatomical findings, structures, identifications are done. If measurements or annotation are asked, findings are documented. Quality check, review, and case complete. This is usually done in 3D slicer like tools because dentist knows dental anatomy, radiographic interpretation. They also understand pathology and knowledge of implant and surgical anatomy. Additional skill you should learn is CBCT interpretation, 3D anatomy, DICOM files and basic image concepts, implant planning software, digital dentistry workflows, basic image annotation, dental CAD CAM designer. They design dental restoration. Instead of making design manually, patients' dental scans or impressions are sent to the designer and they design crowns, bridges, veneers, implants, dentures. You usually need exocad software or 3 shape. Why is this interesting for dentists? because you know tooth anatomy, occlusal restoration, and dental terminology. And if you want to work remotely, this is the best one. You may work with dental labs, clinics, or international client remotely. It is just computer based, remote opportunity, and flexible.